I spent much of yesterday dealing with the NHS, and a lot of yesterday was spent waiting around. In the event, a lot of the process was really about a form filling exercise, and as a as an aside, the hospital decided to take a lot of blood, but I think it was more because I was there rather than because they needed it. And I was astonished by the errors in the form. I was astonished by the errors in the bureaucracy. They'd got my address wrong. It was so radically wrong. They asked me if I belonged to a particular address I'd never heard of. It wasn't that they'd got an old address, they'd got somebody else's address attached to my name. And when the bureaucracy doesn't work like that, in that level of idiocy, one has to start wondering whether or not this imperious approach that the NHS bureaucracy takes to its patients is right. So I certainly questioned yesterday, and I was told, well, did I have the NHS app? And the NHS app would give me access to all my GP notes. Well, I didn't, and apparently I have to get the NHS GP service, so I have to ask my GP to put me on a list so that I can have the app and have the access to my notes. But I'd asked for copies of my notes a while ago because some of my notes had got had got destroyed while I was in hospital, and I got a copy of my notes, and the copy of my notes bore no resemblance at all to the notes that I'd seen while I was in hospital. In fact, quite different diagnosis. And it's that level of incompetence, I'm sure I'm not alone, that probably has resulted in a poll taken which has come to light yesterday, which says that satisfaction in the NHS has fallen to its lowest level in 40 years, and just 24%, that's less than a quarter, of all respondents in England, Scotland and Wales said they were satisfied with the health service that they have been receiving. A drop of 5 points from the previous year. Well, if I'd been asked, I would definitely not have added my name to a list of approval. I think the NHS, number one, is underfunded, but number two, is utterly unreliable because its bureaucracy doesn't work. And yet we pay more money to the bureaucrats than we pay to the people who are actually doing the work. Why do we have people like Paula Venables, a failed administrator in the post office, taken on by the NHS as a senior bureaucrat? Why do we have these bureaucrats who are incompetent, who demonstrate again and again? When I was in hospital, there was a crisis because the bureaucracy hadn't functioned. It was the second time that I was in hospital where the bureaucracy failed, where what I had said, which was correct, about my own blood condition, which is a form of haemophilia, was ignored by the haematology department in both the hospital I went to in Coventry and earlier by the hospital, ironically, which was part of the same NHS trust that deals with my haemophilia issues. Ignored in both cases. In the first case, they ignored it while they did their own investigation and my appendix burst, leading to peritonitis. In the second case, the haematology people nodded sagely and said, yes, of course, we're going to contact Oxford, and then didn't. And they took medicine off the shelf, a thing called tranexamic acid, and pumped that into me in the blithe belief that I would be okay. Of course, what I need with the condition that I've got is very specific blood products which are going to stimulate the bits of my blood that aren't working. They didn't give me that, so 2 weeks later, or about 10 days later, the contents of my abdomen exploded, and I was bleeding for a further 2 weeks. I had to go back into hospital for two extra weeks. What a waste of money! What anxiety that caused, and it was entirely because of a bureaucratic mess. I wrote to the hospital. I got a 10-page, almost incomprehensible letter back, explaining, among other things, admitting that yes, they hadn't done the right thing at that time. But how many more times am I going to go into hospital and get better treatment? It's not something you do regularly. When you need that hospital service, you expect it to be right. And it was perfect in terms of the medical treatment that I received from my consultant. And the error was bureaucratic. The error was purely bureaucratic, because the bureaucracy in the NHS does not work. Now, 3,374 people were sampled for this poll. And I suppose there's some element of frustration with the strike action in the NHS as well. But dissatisfaction must be pinned, in part, on that utter failure of the bureaucratic behemoth, which is the NHS. Utter failure. And Jessica Morris, who's the author of the report, has said that the findings should serve as a warning to politicians in the run-up to the general election. It is worrying how consistent this is across different NHS services, with inpatient, outpatient, dentistry and GP services reporting record low levels of satisfaction, because you can't trust the NHS in whatever aspect you have to interface with it. It is bleak. Dan Wellings is a co-author of the survey. It's bleak, saying they should not be surprising after a year of strikes, scandals, and sustained long waits for care. The government, in contrast, says we're making good progress in cutting waiting lists in England, which is one of the Prime Minister's top priorities. Despite winter pressures and the impact of industrial action, overall NHS waiting lists have decreased for the fourth month in a row, and we've delivered on our commitment to provide an extra 50 million GP appointments months ahead of schedule. That means nothing. When you try and get a GP appointment, it's not available. And you think, what is the point? What is the point in spending an hour on the phone at 8 o'clock in the morning to try and get a GP appointment later on that day, or some other day? Or you think, oh, I'll help the GP. I'll call in the afternoon and see if I can make an appointment for tomorrow. No, you can't. Because everything is a scramble at the last minute, because that's the way that it's been designed to cause maximum inconvenience both to the GP practice and to the patient. There doesn't seem to be any way round this mess, because that's how the bureaucrats have set it up, so that we are like dogs, drooling and waiting to be fed. So if we are waiting long enough, then we might be happy with the crumbs that we are tossed. It's not a health service. This is some sort of second-rate gesture of contempt. And it's got nothing to do with the doctors or the nurses. who are staffing it. It's to do entirely with the bureaucracy which is failing, and that is partly to do with the government. Who in their right mind thought that it was appropriate for a failed CEO of the post office to move into a senior position of management in the NHS? That Paula Vennell's story sums up the NHS at this moment. And Matt Hancock and the selling off of PPE and the whistleblowers who are treated like dirt under the shoe of Paula Vennell's. And it goes up to the top. It goes up to people like Jeremy Hunt, who were in charge of the Ministry of Health. And right up to the top, the present government cannot turn round and say, oh, well, this was done by somebody else. No, it was done by them. And it's about the bureaucracy that they have overseen. And do we need to be, even a Labour government coming into power, it takes too long to train up new doctors, new nurses, for the effect of any positive change to be felt for years. There is positive change that can be effected, but I don't think the Labour Party is even thinking about it. The Labour Party is thinking about getting more doctors, getting more nurses, getting more dentists. Actually, what we should start by doing is getting less bureaucrats, trimming the bureaucracy, getting rid of the dross, getting rid of the overpaid rubbish. And it needs to go. It needs to be chipped away and thrown out